Welcome to Understanding Human Anatomy. This video will discuss the bones of the leg, the tibia and fibula. Anatomically, the leg is the area between the knee and the ankle. In previous videos, I've discussed the skeletal anatomy of the pelvis, and we discussed the bone of the thigh, the femur. So we're going to start with drawing the tibia here. And the tibia has an extension on the medial side. And we'll come back up like so. And we have an area that projects in the middle like this. Now, if you look at a section through the shaft of the tibia, it will appear triangular. So this is posterior, this is anterior, and on the anterior surface we have kind of a point. So what I'm going to do, since the proximal part of the tibia is wider, we're going to make a drawing like this so that it comes down into the point and bring the point down the length of the bone. So this is the basic structure of the tibia when viewed from the anterior. So let me start putting some labels in. So we'll start with the medial condyle. That articulates with the medial condyle of the femur. We're going to have the lateral condyle, and the lateral condyle articulates with the lateral condyle of the femur. And there is a projection between the medial and lateral condyle, and that projection is the intercondylar eminence. And we'll draw a line to it right there. And then on the anterior surface, just slightly inferior to the proximal end of the bone, we have the tibial tuberosity. And the tibial tuberosity is an area for muscle attachment. In particular, the patellar ligament, which is providing attachment for the quadriceps muscles, attaches at the tibial tuberosity. It may be just a slightly roughened area, maybe a little bit elevated, or it may take on the form of the patellar ligament extending superiorly up towards the patella for a significant distance, an inch or more. So this variability in the size and shape of the tibial tuberosity is due to how strong the quadriceps muscles are and how much pull they're putting onto the bone. Remember that bone is not static, it adapts. And when it's being pressured, it will add more bone to strengthen itself. Now, as we come down the shaft of the bone, we're going to have this projection inferiorly on the medial side, and this is the medial malleolus. And the medial malleolus is that bony bump on the inside of your ankle. And it helps form the articulation with the talus, the bone in the ankle that the tibia connects to. So these are the major structures of the tibia. Before I move on, let me label the tibia. The second bone of the leg is the fibula, and it does not articulate with the femur, it articulates with the tibia. So let me draw in the head of the fibula, and we'll come down as the shaft of the bone comes down the distal end, articulates with the tibia, and then there's an extension inferiorly, the lateral malleolus, and we'll then come back up and over to the head. So now this is the fibula. And I want you to remember that the fibula is not a weight-bearing bone. Its function is really to help form the joint inferiorly with the ankle bones, the tarsal bones, and to serve for muscle attachment. And the principal pieces of the fibula are the head, at the proximal end, and the lateral malleolus at the distal end. And the lateral malleolus helps hold the tarsal bones in the joint, keeps the joint from dislocating laterally. And the lateral malleolus is that bony bump on the outside of your ankle. Now, the fibula forms three joints with the tibia. There's three articulations. The proximal one is between the head of the fibula and the lateral condyle of the tibia. And you'll find that we will see some ligaments in this area holding the two bones together. I'll fill in the structure to indicate those ligaments. And then there are ligaments inferiorly running between the fibula and tibia, and these ligaments are holding the distal ends of the two bones together. And then there will be a membrane, much like we saw in the upper extremity, an interosseous membrane running in the middle between these two synovial joints, proximal and distal joints. And this interosseous membrane is not so much holding the bones together, but is providing surface area for muscle attachment. And let me label the interosseous membrane. There. So this is the skeletal structure of the leg. The tibia and fibula. The tibia is the weight-bearing bone, and it is the one that actually articulates with the tarsal bones. The fibula is there just to hold the tarsal bones in the joint, prevent them from dislocating laterally. So fibula on the lateral side, tibia on the medial side, and again the tibia is a triangular shaped bone, so its anterior surface is two-sided, a medial and lateral side, providing quite a bit of area for muscle attachment. So that concludes our discussion of the tibia and fibula. Thank you for your attention.